Page 5, Functioning. One of the defining characteristics of life is the ability to function. Functional health can be categorized as being present or absent, having high level or low level wellness, and being influenced by neighborhood and society. Functioning is integral to health. There are physical, mental, and social levels of function, and these are reflective in terms of performance and social expectations. Function can also be viewed from an ecological perspective, as in the example of walking used previously. Loss of function may be a sign or symptom of a disease. For example, a sudden loss of the ability to move an arm or leg may indicate a stroke. The inability to leave the house may indicate overwhelming fear. In both cases, the loss of function is a sign of a disease, a state of ill health. Loss of function is a good indicator that a person may need nursing intervention. Research in older adults indicates that a decline in physical function is a seminal event and may indicate the future loss of physical function and death. Health. Health, as defined as in this text, is a state of physical, mental, spiritual, and social functioning that realizes a person's potential and is experienced within a developmental context. Although health is in part an individual's responsibility, health also requires collective action to ensure a societal and environment in which people can act responsibly to support health. The culture and beliefs of people can also influence health action. This definition is consistent with the WHO definition of health as the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity, but moves beyond the definition to encompass spiritual, developmental, and environmental aspects over time. The physical aspect includes one's genetic makeup, which when combined with the other aspects influence one's longevity. This broader definition is applicable across the lifespan, as well as in situations where illness may be a chronic state. For example, in the broader definition of health, a person with diabetes may be considered healthy if he or she is able to adapt to his or her illness and live a meaningful, spiritual, satisfying life. Health is considered to be part of a meta-paradigm for nursing, which includes the 4 concepts of a person's health, environment, and nursing. As can be seen in the discussion thus far, health can be viewed in a variety of ways. Next section, illness, death, and disease and health. It is easy to think of health or wellness as the lack of disease and to consider illness and disease as interchangeable terms. However, health and disease are not simply antonyms, and disease and illness are not synonyms. Disease literally means without ease. Disease may be defined as the failure in a person's adaptive mechanism to counteract stimuli and stresses adequately, resulting in functional or structural disturbance. This definition is an ecological concept of disease, which uses multiple factors to determine the cause of disease rather than describing a single cause. The multifactorial approach increases the chance of discovering multiple points of intervention to improve health. Illness is composed of the subjective experience of the individual and the physical manifestation of disease. Both are social constructs in which people are in imbalanced, unsustainable relationship with their environment and are failing in their ability to survive and create a higher quality of life. Illness can be described as a response characterized by a mismatch between a person's needs and resources available to meet those needs. In addition, illness signals to individuals and populations that present balance is not working. Within the definition, illness has psychological, spiritual, and social components. A person can have a disease without feeling ill. A person can also feel ill without having a diagnosable disease. Our understanding of disease and illness within society, overlaid with our understanding of the natural history of each disease, creates a balance for promoting health. Next section, planning for health. Public health has always been the prevention of disease in society as its focus. However, during the past 30 years, the promotion of health and individual responsibility moved into the forefront. within public health, becoming a driving force in health care reform. A key milestone in promoting health was the adverse of Healthy People, the first Surgeon General report on health promotion and disease prevention issued by the later years of President Carter's administration. The document identified 3 causes of major health issues in the United States as allowing careless habits, environmental pollution, and harmful social conditions to persist to destroy health, especially for infants and children. Healthy People was a call to action and an attempt to health goals for the United States for the next 10 years. Each decade, overreaching goals are identified for healthy people. Unfortunately, a change in political leadership, a lack of political and social willpower, and the spiraling of hospital-based healthcare intervened. The need to repeat progress toward the national objectives led to a larger, renewed effort in the form of the 1990 Health Objectives for the National Mid-Course Review. The Mid-Course Review noted that although many goals were achievable, the unachieved goals were hindered by current healthcare status, limited progress on risk reduction, difficulties in data collection, and a lack of public appearance. Healthy People 2000 and Healthy People 2000 Mid-Course Review and Revisions were marked documents in the consortium of people representing national organizations worked with the U.S. public health officials to create a more global approach to health. In a management by objectives approach was used to address problem area. These 2 documents became the blueprint each state as federal funding for programs became available, meeting those national healthcare objectives. While the objectives became more widely implemented, methods for collecting became formalized, and the data flowed back into the form for the revision set in 1995. The core of the health collectives remained, and that is prevention of illness and disease are the foundation for health. Health People 2010 Public Health Service introduced 2 overreaching goals. See the table on 1.1.